Hi, this is Andrea Kane, and I'm here with you for HIT 330 Healthcare Delivery Systems. We are now on week 15, and so we have moved on to chapters 12 and 18. Chapter 12 is Healthcare Information, and chapter 18 is Performance Improvement. You cannot have performance improvement without healthcare information, so that's why those two chapters are together. And this week we are focusing on the topic of quality in healthcare. If you look at your syllabus, you can see we're on unit objectives 9.9.1 through 9.9.6. And if you are following along in your textbook, we are on page 363. So let's take a look at healthcare information. And yes, you will have a second video after this for this week on chapter 18. Healthcare information is very important. In your book, on the bottom of page 363, it says, healthcare information is used to monitor the quality of patient care, conduct medical research, and accurately reimburse healthcare organizations. That one statement is absolutely critical to know. I need you to know all the content in that statement. Hint, hint, hint. Because that's going to form the basis not only of what we study this week, but what you need to know in the future as you move forward with health information technology and that program. So, health information is based primarily on personal health data about individuals, primarily for provider use in the management of patient care. But just because it's primarily for that does not mean that's all that it is used for. The data in health information really falls into two major categories. There's claims data and there's EHR data. Claims data comes from the EHR data, it uses much of the EHR data, and it's used not only for financial purposes but also for research as well as for reporting and analytics on quality. Comparisons, that type of thing. EHR data is really that detailed clinical content of that encounter. It has all of that information. It's generated primarily by the providers. There is some individual information from the individual, and all of that is together, and from that is pulled claims data that then goes on to be used for so many other things. And we already talked about secondary use of healthcare information. Remember, we talked about how registries and databases are a secondary use for administrative, quality, performance, and research uses. So let's talk about data analytics. Now we're on page 365 in your book. Data analytics is the science of examining raw data with the purpose of drawing conclusions about that information. You're taking all these pieces and parts and you're trying to identify, to find, are there rates, are there patterns, are there trends, what happens over a period of time, what is unusual, what is consistent. And so you're looking at all of these different types of things. There are some different types of analytics. Oops, sorry, did I go the right way? Yes, I guess I did. Okay, so data analytics, there's different types. You have healthcare in general, and an example of that would be financial information. And then you have clinical, and an example of that would be lab values. Data analytics, there are different types. And your book talks about this, that descriptive analytics answers the question, what happened? Diagnostic analytics answers the question, why did it happen? Predictive analytics answers what will happen, and prescriptive analytics answers how can we make it happen. Make sure that you know these four types of analytics and the questions that they're asking. You will need that. Hint, hint, hint. Not just for this class, but in the future, you need to understand what those differences are. So it gives you the example that descriptive analytics could be centered on the increase in the incidence of Legionnaire's disease in individuals 65 years and older in a specific state over a 5-year period of time. Diagnostic analytics would then review the why have these rates increased. Predictive analytics would be once the Y is found, could it be extrapolated that an increase or decrease will be seen in other states if certain conditions are found? And then prescriptive analytics would examine ways to reduce the potential rate of increase of Legionnaire's disease if certain conditions occur. So that's a good way. And analytics involves acquiring, managing, studying, interpreting, and transforming data into useful information. Let me say that again. Analytics involves acquiring, managing, studying, interpreting, and transforming data into useful information. These types of data include clinical, financial, and operational data, and the types of analytics include healthcare data and clinical data. And we talked about that healthcare data is used to make business decisions, and clinical data is health information captured, reviewed to measure the quality of the care. And so that's why we talked about the example of financials being healthcare data analytics, whereas lab values or outcomes would be clinical data analytics. And steps that you would go through with this include capturing the data, which is usually in a database, provisioning it, making it available, and being able to actually have the tools that you need to do the number crunching, so to speak, or the sorting and the trending and that sort of thing. And then the analysis, where you're actually looking at it and identifying trends. In your book, it talks about analytics tools on page 366, where there's data visualization. You have your graphs and charts and things like that, or a dashboard and a scorecard, maybe some key indicators, and those are all tools that you can use to start analyzing the information. And then it goes into data capture tools on page 367. And it really talks mostly about charting with that. And then on page 369, it goes into data mining. And data mining is the process of extracting and analyzing large volumes of data from a database for the purpose of identifying hidden and sometimes subtle relationships or patterns and using those relationships to predict behaviors. That is very critical for you to know. You need to know the definition of data mining. I guess I've fallen behind here on my slides. Sorry about that. Really quick, we talked about data visualization, dashboard, data capture, structure. That's all in your book, pages 366, 367, 368. We talked about tables, charts, and graphs briefly, and that's in that same page range. And then dashboard is different from a scorecard. It has key indicators, metrics, or benchmarks. There's the purpose for that is on page 367. So just read through there for that information. And then data capture, talked about how that's really the EHR. It's recording the data and how you do that, how it's captured. And then EHR, all of that. And there's point of care charting that can be structured or unstructured or both. There's also word processing, copying and pasting, which I think we've talked about copying and pasting, and some of the issues that can come along with that. And if not, we will talk about that in a future class because there are a lot of issues associated with that. There's front end and back end speech recognition as well as natural language processing. And that's talked about on page 368. So now I'm up to data mining. Sorry about that. I was jumping ahead. So data mining, this is the process of extracting and analyzing large volumes of data from a database for the purpose of identifying hidden and sometimes subtle relationships or patterns and using those relationships to predict behaviors. Data mining is used quite a bit with the government when they are looking at quality and trying to identify also fraud patterns of fraud and abuse. They have enormous databases full of claims data, and they constantly have programs running to identify anomalies, to identify patterns, and all sorts of things. So what are sources of data that are used for data mining? That's where you get into the data repositories and warehouses. And remember, a warehouse is multiple databases. It's data that's been pulled together from multiple databases. That's the warehouse. The repository is a central database that just focuses on clinical information. And this is on the top of page 369 in your book. So what are health information professionals and analytics? What is that relationship and how are they involved? And this starts at the bottom of page 369. And I'm going to leave you to read through that, but essentially this is a big part of our training so that we're proficient and knowledgeable about data and analytics and can be of use in the professional field for those types of things. As the field of HIM, HIT has moved away from some very manual, hands-on activities with a lot of paper and organizing and storing and retrieving paper, we have moved much more into information and knowledge. And because we are in an electronic world, that's where we're going. So our field has moved in that direction. Some strategic uses of healthcare information include decision support, executive information systems, quality measurement, and clinical research. Decision support, this is on page 370, and it's an information system that gathers data from a variety of sources and assists in providing structure to the data by using various analytical models and visual tools to facilitate and improve the ultimate outcome in decision-making tasks associated with non-routine and non-repetitive problems. The example that they give is that a decision support system can help administration decide whether or not to add an additional operating room. So they're pulling together information from different places, different systems, different sources, and they're running models to see, okay, how many surgeries are we performing? Do we have delays in surgeries occurring because of room turnover or because we don't have enough rooms? How are our surgeons utilizing their time? There's all these different things that you can do with a decision support system. A clinical decision support system is a special subcategory of that, and that's really to help healthcare providers make knowledge-based clinical decisions, best practice, evidence-based decisions. Most healthcare organizations today have a major decision support system, but they also have clinical decision support modules throughout the EHR to help providers and other clinicians provide care and make decisions. And then it talks briefly about an executive information system, and we will get into that next fall in a class that you have. So you don't really need to get into a whole lot of these. Just again, if the term is in that teal turquoise color, make sure that you know what the definition is. And then moving on to quality measurement. Quality measurement has really grown because you can imagine as IT has grown, it's given all these new tools to be able to analyze things at your fingertips electronically. And so everyone is measuring quality these days from different ways. And I think this week we're going to get into AHRQ, yes, AHRQ and NCQA. Those groups are heavily involved in quality measurement, and you'll see that as we go forward. But prior to all of the electronic health information, it wasn't possible to pull this together easily or quickly. I mean, you could do it through paper, and there were some minimal accounting methods to do it, but it's not the same way as it is today, where we have all these electronic tools that pull it together and help us to clearly see what are we missing, where are our gaps, and those types of things. Clinical research, this is also on page 372, and again, it's really trying to have patient-centered outcomes. So consumers and health information. Are consumers interested in health information? Absolutely, they need to be. Um, the healthcare industry as a whole is trying to make the consumer the focus. They have done this through creating patient portals, providing clinical email communication, providing mobile health, trying to educate and increase health literacy, and then providing telehealth. And all of these are talked about going through, starting on page 373, all the way through 376. Actually, even further, because it goes into social media as well. So I would say, yeah, even into 378, where it gets into the PHR, the personal health record. So patient portal, this is where you can go in. Most healthcare providers have a type of patient portal where you can go in, you can pay your bill, email your doctor. You can get information about your condition. You might even be able to see parts of your medical record. And some even have integrated where you can do telehealth through that rather than a separate link, whereas others do a separate link. So you've got all of that available to you. Health literacy. This is the ability of the patient to understand health information and the healthcare system. And there are many things behind this. And this talks about health literacy starting on page, I think it's here. Yes, page 373, it talks about health literacy. And this is really critical. The more you learn about health literacy, the more interesting it is. And about what they have found is that patients who struggle with health literacy struggle with caring for themselves. They struggle to understand their condition. They struggle to understand what they can do to improve their situation, to make sure that they take their medicines appropriately or that they follow the health care recommendations of their providers. They just really struggle because it's a totally different world in healthcare. And if you've taken your medical terminology course, there's a whole language associated with that. Anyway, on page 375, there's figure 12 or 12.4. There's 4 levels of literacy, and it goes through here what they are. And your book talks about how there are several government programs trying to improve health literacy across the nation in ways that they want providers to be a part of that. So I'm not going to go into a whole lot of detail there because you can look at your book and read through all of that. Telehealth, I think we're all very familiar in this COVID world with telehealth. It does increase the access to quality healthcare. People who live in rural areas, especially out west, they struggle to have access to some specialties in medicine. And through telehealth, they're able to have those consultations or be able to have access to those providers that they wouldn't necessarily have in person in front of them in their rural area. And it also connects patients and clinicians across a distance. Telehealth has many aspects to it. And again, this is in your book and you can read about this, and we will study telehealth more times in your program. So don't worry about that. But telehealth can also include um, having an ICU where patients are monitored remotely by very highly skilled intensivists who are physicians who specialize in intensive unit care, and they can be miles away, but yet they're monitoring those patients real time, giving orders, providing insights, and helping with that, improve those patients' care in a way that couldn't happen without telehealth. So there's some really cool stuff that can be done. And again, you've got all of these types of things that are benefits with telehealth. The biggest barrier to telehealth is patient adoption. And I would also argue it is sometimes telehealth itself. Recently, I had a child who had strep throat a couple months back, but in the fairly recent time of COVID, and the doctor wanted to do the visit through telehealth. It's a bit hard to have a provider examine someone's throat through telehealth. We ended up having to actually go to the parking lot, and the physician gowned and gloved and masked and face shielded up came out and ended up taking the sample, and of course it turned out to be strep. That is the problem with telehealth, is that even though it talks about patient adoption here, some of the practicalities of that still require an in-person provider to examine the patient. Not everything can be done over telehealth or should be done over telehealth, but many things can. So even though it talks about patient adoption here, I would also say that the logistics of it don't always work. Patient portals, I talked briefly about this, all these different things that you can do there with those. Social media, consumers and providers, government agencies, all are utilizing social media these days. This is on page 377 if you want to take a look at that. Personal health records. This is a record that's created and managed by an individual in a private, secure, and confidential environment. It is different than an EHR because this is patient-generated health data, and the patient is the one who is maintaining it, updating it, and all that type of thing. And it gives you the in your book, it talks about the contents of a PHR, and that's on page 378. And there's also models. There's a standalone versus a tethered or connected, and it kind of walks you through all of those. And talks about sources, patient safety. Sometimes it provides a more complete picture of a patient's health. Sometimes it can support telehealth. It can also deliver information in an emergency situation. And then it talks about what are HIM roles. When it comes to consumer informatics, how can we be involved? And these are some different roles that HIM people have been part of. On to health information exchanges. I'm not sure how much we have done with this. I think we've touched on it a bit, but we will go through health information exchanges thoroughly in a class that you will have next fall. So I'm not going to go too deeply into it here. It starts on page 380, and I'm just going to let the book guide you. Make sure again that anything in teal you are familiar with. There are 3 definitions for HIE on page 380. Make sure you're familiar with all 3 of those. They are bulleted. And it's really the exchange of health information electronically between providers and others with the same level of interoperability. And It involves a lot of group of people with, or a lot of programs and laws and things like that with health information exchanges. Um, this has been a number of years in development and continues to develop over time. And like I said, the book is really where you're going to want to go for this information. It talks about the impact of the HIE, what is interoperability, make sure that you know that health information exchange and health information interoperability are not the same. How are they different? You need to know that. Forms of HIE, there's directed exchange, query-based exchange, and consumer-mediated exchange. Make sure you know those three, page 381. Make sure you're familiar with benefits of health information exchange. That's bottom of page 381. Here are the impacts. And interoperability, the different forms that I just mentioned, those three different forms. Benefits that you need to be aware of. Users, this is on page 382. These are the primary users of HIE. This is what they're working toward, is a nationwide community of exchange partners, and this is the eHealth Exchange. And talks about what that is. It goes through all of that. Some challenges that they have are patient identity, I should say identity, not identify, data integrity, and common data standards are, of those, common data standards are the easiest to be implemented. There's a lot of controversy, I think, over patient identity, making sure patients are who they say they are. Having been out in the real world, that has been a challenge in every organization I have ever worked in, for a variety of reasons, depending on where I was in the country. But sometimes when you have people who are non-citizens, you often have some challenges with patient identity for a variety of reasons. So this is patient identity is on page 383. And data standards, those are the specifications that are agreed upon for the values acceptable for the specific data fields. That's at the bottom of page 383. And it goes into data standards. Vocabulary, code sets, terminology, content and structure, transport services. Again, I don't expect you to know those, but table 12.1 at the bottom is helpful for you to be aware of, because you will have a class next fall that goes into this in extensive detail. So for now, it's just enough to kind of be aware of this information. But I would say that as long as you know what's bulleted in your book, that's probably more than enough information. Doesn't need to get down to some of the detail that they've given you in these tables. So HIM rules, that's on page 386, and talks about how HIM professionals can be involved in health information, HIE, consumer informatics, all of that. And that is it for chapter 12. I will be back shortly with chapter 18. Thanks.